Hi, Dr. Henry. My question is actually about flu shots. Some Metro Vancouver pharmacies are now, just today, getting their first doses and starting to vaccinate people. The ones I spoke to said they have never seen a demand like this before. It's unprecedented. Getting an online appointment right now is basically impossible. Do you have any concerns that there will be enough flu shots considering the demand that's out there?
Yeah, well, we hope so. This is something we've been paying attention to since way back in February. We have a process in Canada for global purchase of influenza vaccines, and when we saw what was happening in the Southern Hemisphere, where their influenza season started in April and May, we ordered extra vaccine this year. We have had no delays in the manufacture of vaccines. That happens sometimes, some years. So we're confident that we have, some of it has started to arrive already. The most of it will come in the coming 2 weeks. And the ideal time to be immunized, as you say, is in the end of October into the early November. So we expect that we'll see much more vaccine available across the province. It's distributed across the province right now, and we're starting to get it out there. There'll also be both physicians, pharmacists, public health clinics. We have a plan to make sure that we can safely get a vaccine to as many people as we possibly can this year, and to do it in a way that makes sure we're not putting people at risk for COVID as well. So it is an important year for people to protect themselves from influenza. This vaccine doesn't protect you from COVID, but it does make sure that you're not going to get infected with influenza, or it goes a long way to help that, which means that we reduce the pressure on our healthcare system. So this is, if any year, the year you should get your vaccine, and it should be available in the coming weeks for everybody who wants it.
Do you have a follow-up, Shannon?
Yeah, do you think that right now, with this big rush that's starting, should healthy, relatively younger people maybe wait and allow the older or more at-risk population to book the appointments now? Because as I said, I went on the London Drugs online portal and there are no available appointments. It seems like everyone is rushing now, but would you suggest maybe healthier people can wait a few weeks? There's no need to panic?
I think that's a very good advice, yes. There will be lots of vaccine available, and it'll be coming over the next few weeks. So it is important for those who are most at risk, or for healthcare workers, people who are spending time with people who are most at risk, to be immunized first. Those are the people we would encourage right now. We do have special clinics for people in long-term care as well as for healthcare workers. But yes, this is the time when we should be deferring to our seniors and elders in the community to make sure they're protected as well.